I'm Dr. Blanche Grube, biological dentist from Scranton, Pennsylvania. I would like to give you a layman's explanation of exactly what is a root canal. I'm a firm believer that when patients go to the dental office, very often they don't have informed consent. They don't have informed consent because they don't understand what it is that the dentist just told them they need to have. So I'd like to give you an explanation of what I think Root Canals 101 is really all about. I'd also like to have a little fun with this because science can be a little bit dull, and if you don't have the vernacular, if you don't have the history of having the knowledge behind you, you could get lost in the shuffle. So I'm going to make this presentation a little bit on the comical side, and so forgive me if I offend anybody. So first thing I'm going to do is draw a tooth. This is your typical molar. Just went to the dentist and the person found out that they have a cavity, which means that they have a hole either on the, usually it's on the side and between the teeth. Sometimes the cavity is a hole up on top here. So just what is a cavity? We have to start with that because that's what leads usually to the root canal. Cavity is a lot of bacteria that have been given the opportunity to colonize, and after they have colonized, they have formed something called plaque, and that plaque is very acidic in nature, and it's been able to demineralize the tooth. As the colony demineralizes the tooth, which means it literally sucks away the hard substance of the tooth, the bacteria then can go deeper into the tooth. That's important because inside the tooth you have an enamel layer. This is the enamel layer, and that's very hard. That has a lot of minerals in it. Once the cavity gets big enough and it's gone through the enamel layer, then it goes into the next layer, which is called the dentin. I'll put a D there for dentin. That's the dentin layer. Well, the bacteria like the dentin better than they like the enamel because it's softer, and bacteria are like we are. We'd much rather have something soft to eat, something that's soft and warm, rather than chewing on a cold carrot every day. All right? So that's what the bacteria do. They eat up the enamel, then they travel into the dentin. Eventually, their goal, though, is to get down to this red area called the pulp. I also call the pulp kind of like the holy of holies, because once the bacteria, there's a pretty big cavity now at this point. Once the bacteria enter into the holy of holies, or the pulp, they're very happy now, because now they can eat all of this. You might at this point feel like you have a toothache, because the pulp is full of blood vessels and some lymph. And as everybody knows, lots of nerves. I'm always amused when patients say to me, "Make sure you don't hit my nerve." Well, it's not my nerve, it's many nerves. There are millions and millions and billions of nerve fibers in this area. So when the bacteria enter into the pulp, those nerves begin to pulsate, and you might have a severe toothache. And at that point, you go to the dentist and tell the dentist you think you have a deep cavity that has to get fixed. Well, suppose you don't go to the dentist. Suppose you're able to be very stoic and you're able to ignore the pain, and you don't go to the dentist, and now this cavity has gotten bigger, and maybe even a cusp broke off. That's gone. It's gotten really big, and it's into the pulp of the tooth, and the bacteria have now eaten all of this. Okay? When they're done eating everything in here, then they can come out at the end of the root tip. They can come out and start enjoying the wonderful blood circulation that's in the bone. At that point, the dentist might see a dark circle around the bottom of the root. And if the dentist sees that dark circle, the dentist will then tell you that you have an abscess. You have abscess forming down here, and the tooth needs a root canal. Or the dentist would probably say to you, you have to have a root canal. You have two choices at that point. You either have a root canal or you have the tooth extracted. Most people don't want to lose teeth. So most people would say, yes, give me the root canal. So just what is a root canal? Let's get to another picture. Here's our famous tooth again. And let's make some bacteria inside the pulp. Okay. Okay. And what the dentist does is drill a hole, an even bigger hole, on the top of this tooth, and then using files is able to clean out these canals. Now, front teeth have one canal, bicuspids have two canals, molars have 3 or 4 canals. That's in general. Not everybody is the same. Some people have a front tooth that has 2 or 3 canals. Some people have bicuspids that have 3 canals. Some people have molars that have 4, 5, possibly even 6 canals. So the dentist cleans out what he or she thinks is the main canal. And then when the dentist thinks the canals are clean, then they fill the tooth. Well, we have to stop right there, because what do they mean by clean? Well, the dentist usually takes something called a paper point, puts it down into the canal, picks it up, and smells it. And if it smells clean, comes to the determination that the root canal is now ready to be filled. I've always thought that was very interesting, because smelling something with your nose is kind of archaic. The dentist will also look inside the canal, and if the dentist doesn't see any bacteria, the dentist will say the canal is ready to be filled. I think that's kind of archaic also, especially since you cannot see bacteria with the naked eye. So, be it as it may, the dentist will say that this canal is now ready to be filled. And so what do they fill it with? Well, most root canals are filled with something called gutta percha. Gutta percha is a rubbery material that comes off a tree in South America. In and of itself, it's a relatively safe material. But that gutta percha is mixed with cement. So we have rubber and cement. Well, what's inside the cement? Well, some antibacterial. That's good. Anti means against. Bacterial means bacteria, against bugs, right? There's also something called phenol and formaldehyde. Well, what are those? These are what we call fixing agents. In other words, they fix the tissue in time and space so that it does not continue to degenerate and it does not become necrotic. That's another fancy word for dead. It does not rot away. The ancient Egyptians used a lot of phenol in their mummification of the imperial palace. They would dip gauze in phenol and wrap the body, and it would keep or fix the tissue of the great Sphinx and the great Egyptian kings. Their body would dehydrate, but it would not rot away. And that's exactly the intention inside of a root canal tooth, to maybe dehydrate this a little bit, but not get it to rot away. Okay, so then the gutta percha is placed in here. It's pushed down really tightly, and then with a hot instrument, remember it's butter, it's butter, ha, I wish. Remember it's rubber. With a hot instrument, the rubber up here is sealed. And the intention of the dentist is to seal the whole tooth so that no saliva gets inside. We don't want that because saliva has bacteria. And no other bacteria can get inside the tooth. Okay? So that's that. Now the root canal is complete. Now I'm going to tell you the rest of the story because I believe all patients should be informed. Here's our famous tooth again. This time, though, it has root canal filling material in here. That's all sealed up. Okay? Now, when this tooth had a cavity, the bacteria were coming down this direction into the pulp, and they continued to come down the canals, and then they did something else. They went sideways into the lateral canals. You see, because a tooth is not just what we can see with the naked eye, the tooth is also microscopic. If you were to take a section of this root, and let's put it under the microscope, let's make it bigger so that we can see. Like I said before, I want to have a little fun with this. So we got some bacteria in there, and they're all cousins of mine. So we're going to name them. We've got here Pepe, Jose, and Manuel. Okay, Pepe, Jose, and Manuel came down when there was a cavity here, and they saw that the root canal was happening and that there was a lot of activity going on in the main canal. So the three of them decided, hey, Pepe, there's lots going on over here. Maybe we should, head down into one of these caves and hide out until the things get better, until the going gets good again. So, all right. Jose and Manuel both agree to go down into one of the caves, and they're hiding out way down here in the area next to the periodontal ligament. Whoa, I thought this was going to be a layman's term. Periodontal ligament, that's the area all the way around the tooth that attaches the tooth to the bone. And so this is where the bacteria like to hide out. They happen to love this area. 5 millimeters from the end to here. This is their favorite place to hang out. And that's called the that means gums. Dontal, that means teeth. Ligament, that means ligaments. Well, that's basically what holds millions and millions of ligaments that hold the tooth to the bone. Well, Pepe, Jose, and Manuel are living down at the very end next to the periodontal ligament. They've been there for probably several weeks. And the dentist says, you know what, it's time to fill the root canal, and fills it with the gutta percha that I told you about. Well, up until this point, Pepe, Jose, and Manuel were aerobic bacteria, which means that they were able to breathe air like you and I. They got air from the inside the tooth. They got air from the blood circulating around the area. They were happy little creatures. Then the dentist seals the tooth. Now there is no air coming down here. So Pepe says to Jose, hey, Jose, are you having trouble breathing? I'm having a little trouble breathing here. And Jose says, yes, I'm having trouble breathing too. You know what? I think it's time for us to undergo, here comes another word, pleomorphism. This is something that bacteria do all the time. Pleo means many, morphism is body shapes. The bacteria will actually change who they are to accommodate the environment. Well, don't you wish we could do that as human beings? We've had so much rain in the last 2 months that I would love to be able to grow large webbed feet to be able to handle the rain. And there are times when I wish I could grow some wings when there's a lot of traffic and just kind of fly over all of it. I can't do any of that. Human beings do not undergo pleomorphism, but bacteria do. So now these happy fellows who were aerobic bacteria are now anaerobic. anaerobic bacteria, non-air breathing bacteria. So what's so bad about that? Well, anaerobic bacteria are the bad guys. For instance, your E. coli. Everybody knows what they are. Anaerobics. Your botuli. Anaerobics. So anaerobic bacteria are much more toxic to the body. Here's our tooth again. Here's our sealed root canal. And again, we've got Pepe, Jose, and Manuel living in these tubules. Well, that's interesting. These tubes that they're living in are about 1/2 micron wide. What's a micron? Well, if I was to take an ink pen and go like that and make a dot, that's about 10 microns. So that gives you an idea of how small these tubes are. It's 1/2 micron wide. Okay? Keep that number in mind. Pepe, Jose, and Manuel are really suffering. I mean, they've changed shape, but they're having a difficult time breathing down there, so they're not happy. Finally, Pepe says to Manuel, "Hey, Manuel, when are we going to eat? There's nothing to eat down here." And Manuel says to him, "Don't worry, brother. It's Friday night. Friday night we have pizza." Oh, that's good. So here's Friday night. Here comes our slice of pizza. So what's pizza made out of? We've got protein, right? There's cheese, has protein. There's fat in the cheese. And there's carbohydrates. Okay? Protein, fats, and carbohydrates are small molecules that actually can seep from the bone into the tooth without any transport system. So here comes their pizza. Okay? That system is it's called osmosis. Osmosis. In other words, when you have osmosis in the body, it means things go from an area of high concentration to an area of low concentration with no transport mechanism. In other words, that pizza did not need to have a delivery man bring it to Pepe, Jose, and Manuel. No. The fat, protein, and carbohydrates in that pizza just seeped into the tooth, making Pepe, Jose, and Manuel very, very happy. They enjoyed all three of those, protein, fat, and carbohydrates. Well, now, this Friday night, they've eaten a lot of pizza. And they may have even had some beer. Well, Pepe, Jose, and Manuel have to do the same thing we do when we have lots of pizza and lots of beer. What is that? You have to go to the bathroom. Pepe, Jose, and Manuel have to do the same thing. So what happens? They go to the bathroom, and when we call those toxins, by the way. You know, it's not so much the bacteria that make us sick, it's the toxins they produce that make us sick. When somebody says they have a yeast infection, it's not the yeast that make them sick, it's the toxins. In other words, their discharge, what they get rid of. Well, when the concentration of their toxins, piss and poop, gets high enough, it seeps right out into the bone. Okay, well that sounds like it might be a good thing. And in actuality, it's not. Here's our tooth again. Okay, and we've got toxins now coming out into the bone. Okay, so here's Mr. White Blood Cell, who happens to be just swimming by in the neighborhood. He's a happy fellow. He knows his job. He knows his job well. His job is to determine self from not self. Self from not self. These little creatures spend the whole day going around self, not self, self, not self, self, not self. Whenever they see not self, then they have to determine, is it something that we just don't like, or is it something that's going to kill us? if it's something that's going to kill us, then they inform the president of Spleen University and tell him that something really bad is down here and we need more attention spent on it. So here's Mr. White Blood Cell. He's swimming by and he smells, here's his nose, he smells something funny and determines that these toxins are really bad. He also decides that he's going to go get whatever bacteria produced those toxins. So he goes up here, but he can't get in because Mr. White Blood Cell, WBC, is about 8 to 10 microns wide. That's pretty big. Remember, I said that the tube that Pepe, Jose, and Manuel were living in, the cave, was only a half micron wide. So Mr. White Blood Cell can't get in there. That would be like somebody my size trying to get into a tube, only this big. Can't do it. So what does he do? Mr. White Blood Cell bangs his head against the wall several times, tries to get in, but he can't. White Blood Cell only lives 7 days. So on day 6.5, he calls his friend. His friend's name is Nicky. He says, hey, Nicky, here comes Nicky. Nicky's a little bit bigger. He's swimming by. He says, hey, Nicky, listen, I've been watching this tooth for 6.5 days now. There's some really bad toxins coming out of it. Smell really bad. I can't get in there, but if the bacteria come out, I want you to get them because I'm on my way out. I've been at this 6.5 days, and you're fresh and new. And Nicky says, yeah, sure, no problem. I'll take care of them. So Nicky has now accepted the assignment of hanging around this root canal tooth to try to capture the bacteria when and if they come out. Well, Nicky hangs around for 7 days. Actually, he quits at about day 6 3/4. And he calls his friend over and says, hey, Tony, listen, I've been watching this tooth for 6 3/4 days now. I'm on my way out. We've got some really bad stuff in here. I would like you to keep an eye on it. And when those guys come out, we heard that there's Pepe, Jose, and Manuel in there. When they come out, make sure you get them. And he says, yeah, sure, I'll take care of it. And so now, remember, white blood cells live 7 days. So every 7 days, you're sending another white blood cell to replace the cell that died that day. And every 7 days, they're hanging around here trying to figure out what to do with this root canal tooth. The body knows it's a dead tooth. The body is trying its best to get rid of it, but it can't. Now, if the root canal was done very well, and the dentist has filled it all the way to the end, more likely than not, some of the chemicals that are in this canal will seep out into this area. And that keeps the white blood cells from ever getting to the tooth. As a matter of fact, Nicky's cousin, Dominic, he said that he tried getting close to that tooth, and he said to his buddy, you smell something funny? And his buddy said, no, I don't smell. Boom. And his buddy was dead. It was the phenol and the formaldehyde killed him. So he never even got to fight this root canal tooth. So if a root canal tooth is done very well by an excellent dentist, an excellent endodontist, that's a root canal specialist. If it's done very, very well, the white blood cells can't get anywhere near this tooth. When you hold that tooth up on an x-ray, it looks perfect. And everybody thinks, wow, what a great root canal. When in fact, your body can't even get close enough to that tooth to defend itself and to fight a good fight. If a root canal is done very poorly, and the dentist doesn't even get to the end, or this is done very sloppily and there's lots of empty space in here, well then the white blood cells can get in. They can sneak in right through here. And a big, huge battle goes on here. And before you know it, there's lots of pus. Pus, that's dead white blood cells. Lots of pus coming out into this area. And then you get a report from the dentist that says, I'm really sorry. That root canal did not take. We will have to redo it. We will have to do it over again. Then they use more formaldehyde to get out the gutta percha and redo the root canal. Anyway, so this is a scenario. So what's so bad about that? Well, you got white blood cells. They're doing their job. They're always working 24/7 all over the body. So here's the problem. You walk into, this is the scenario. You walk into an elevator. Somebody walks in behind you and the elevator door closes and the person sneezes. Achoo! It just so happens that person had hepatitis C. Okay? Now those little viruses, bacteria, everything is just floating around in the air. There's all kinds. If you could have a special kind of light, you would be amazed at the amount of dust, bacteria, and viruses that are floating through the air all the time. So this comes into your lungs. Red alert, hepatitis C, right bronchi, red alert, red alert. And now the body knows that there's a problem in the right bronchi. So the brain immediately calls up the president of Spleen University and says, President of Spleen University, 50,000 white blood cells on the double to the right bronchi. And the president of Spleen University says, excuse me, sir, did you say 50,000 white blood cells? I'm just throwing a number out there. Sir, we don't have 50,000 white blood cells. What do you mean you don't have 50,000 white blood cells? Send 50,000 white blood cells on the double, right bronchi. Sir, with all respect, sir, you remember that root canal, tooth number 19? We've been fighting that root canal for 10 years now. We've lost an awful lot of white blood cells there. I don't have 50,000 mature white blood cells to send you. I'll tell you what I'll do. Suppose I send you 10,000 and maybe another 20,000 immature cells. Will that do, sir? And of course, you know, the brain is not happy about this situation, but nothing they can do. They've been fighting this infection for a long time. So that's problem number one with root canals. They are dead teeth. They are necrotic tissue. They are mummified. Now, here's the body. Oh boy. Now I'm really going to get tested. I think I'll do a stick figure. Here's the body. And we are electrical beings. This is a happy face. Okay? We are electrical beings, meaning that if you were to take the average nucleus in a cell, okay, and measure the distance from the nucleus to its electrons. The electrons are the things that float around the outside. Here's your electron. Okay? If you were to measure that distance from the nucleus to the electron, it's actually a huge amount of space compared to the two particles. As a matter of fact, somebody once said it's so huge that if the nucleus was the size of a baseball, the electron would be 1 mile away. Think about that. If the average nucleus was the size of a baseball, the electron that floats around it would be 1 mile away. So that means we're more empty space than we are substance. Correct? Interesting. So here's our body, and our body has around it an aura, an electromagnetic field. Okay? Well, why is that? Well, because every chemical reaction in the body requires the passing of an electron from one substance to the other. Every chemical reaction in the body requires the passing of electrons from one substance to another, which means that perpendicular to that electron flow, and forgive me my very poor artwork here, perpendicular to that electron flow is an electromagnetic field. So since we have all these electrical chemical reactions taking place in the body, we have an electromagnetic field that goes around us. Well, the Chinese have known this for thousands of years. And they have gone through the trouble, 6,000 years ago they went through the trouble, of mapping every meridian or energy pattern in the body. And it's very interesting that every meridian in the body passes through a tooth. Okay? So here's our tooth again. And it's all filled in here because it had a root canal. And this is all dead. There is no life in it. No circulation. No electron movement. There are no electrons being passed through this thing. So when the meridian comes to this tooth, it gives energy, but it does not get back the same amount of energy. Well, that's a problem. This is tooth number 19. It just so happens that tooth number 19 rests on the large intestine's meridian. That's your gut. So the meridian is coming up from the large intestines, going up to the tooth. This is tooth number 19 on this side. When the energy goes up, it does not come back down equally. So eventually the large intestines will suffer because of the root canal tooth in area 19. So this is the second reason why I don't believe people should have root canals. Number one, they put a tremendous stress on the immune system, which is the white blood cells. Number two, they deplete the body of energy and put a tremendous stress on the energy of the body. Those are two very good reasons why anybody should seriously consider whether or not they should have a root canal. I'm Dr. Blanche Grube. Thank you for your attention.